Hi, everyone. That was, I think, a fabulous setup for the next session. So let's go ahead and introduce the next panel. And I believe a title slide is going to come up to announce who's on the panel. But maybe while that's happening, good morning, good afternoon, good evening. I'm Elisabeth Wilhelm. I'm a visiting fellow in the Information Futures Lab at Brown University School of Public Health. I'm thrilled to be introducing you to this panel on forecasting and social listening approaches. You're going to be hearing from four very different perspectives of people who've been aged and grizzled in the time of COVID-19, who've really been dealing with this in many different ways. And so what we're going to be doing in this panel is examining what we can learn from global and US-based approaches to social listening that can help the US public health system better prepare and respond to epidemics. Social listening, which can be understood as monitoring the information environment before and during an emergency and how it can impact people's awareness, perceptions, and behavior, really has become quite mainstream in the time of COVID-19. It's happening in many countries at the national level, at state and jurisdictional level. It's happening at local health departments. Community-based organizations are doing it. Academic institutions are doing it. So we've learned a lot in the time of COVID-19. Now, if you're doing social listening or infodemic monitoring right, you can identify those narratives that might be harmful as they're emerging, so you can take steps to address them before they become quite widespread. Harmful narratives, especially those that contain misinformation, can grow and spread quickly and can affect communities that are uniquely vulnerable. And so really doing that listening in peacetime and being able to detect changes in those narratives as they're emerging is really critical. And you'll hear that from our speakers today. So you don't have to take my word for it. So you'll hear next in 5 minutes inspirational chunks from the following speakers, followed by a Q&A. First, we have Dr. Neil Johnson, who is a physicist from Washington University, who has authored some of the most seminal works on social networks, trust, and misinformation before and during the pandemic, using mathematical modeling and social network analysis. And so I think the question from the Q&A section of the previous panel really highlights what can the hard scientists bring to the table in this conversation. Then we kind of go from this X-ray approach to diagnosing infodemics and pulling back to the media and information landscape more broadly, and how it affects communities from two different perspectives. First, we're going to have Alejandro Posada, who is the lead social scientist from Internews, who will be reflecting on how infodemics, social listening, and community feedback intersect, and taking this from a global perspective, and why it matters and how this helps prepare us for the next big emergency. And then we go to one of my favorite cities in the United States, to a truly pioneering jurisdiction, which is New York City. Specifically, we'll be hearing from Maddie Perlman-Gabel, who is a communication, engagement, and research specialist in the New York City Department of Health and Mental Hygiene. And they led a lot of this work for the city on a misinformation management unit. So you'll hear from her directly. And then finally, we're going to bring it home from Dr. Chris Voegeli, who was originally all about HIV and STIs as a behavioral science at CDC, and then he fell madly in love with infodemic management while he worked on the COVID-19 response. And so he has since then really played a key role in shaping the CDC infodemic management strategy. Today, he's the acting vaccine confidence and demand lead, and he's building these systems for social listening and infodemic management, and through that work, supporting the needs of states and jurisdictions. So I'm really excited that you have all four of these perspectives that you'll be able to hear from today. And so with that, let's first turn it over to Neil.
Thank you so much, Liz. And Matt, I wonder if we could put up the first slide. Yeah, the one before that. Great. It looks a mess. Hi, everyone. Thank you so much for letting me talk. We set out just before COVID, of course, not knowing that COVID was going to hit, to map out, instead of to try and take the guesswork out of the system of online distrust, trust and distrust. I am a physicist. We understand how water boils not from one molecule at a time, and not just looking at the whole thing, but how the kind of bubbles, how the pockets of correlated objects begin to interact together. And this is what you're seeing here. In the background is a tiny, tiny little piece. Imagine looking up at the sky and seeing a tiny little piece of the sky of interconnected communities. So each one of these circles contains anywhere up to about 100,000 members. It's a Facebook community. The links between them are the links that they establish at the level of the community, say the Facebook page, from one page to another, which directs people users and their comments from one community to another. And it also directs content back from that second community to the first community. And what you're seeing in the background is what we had and what we published in Nature just before COVID hit. So this is the debate. All of these communities are involved in vaccine distrust. So this was November 2019, and the predominant topic, in fact, the only topic among them was vaccines. Of course, it wasn't COVID because COVID hadn't started. But I want to show you in the next, I've only got 2 slides, it's this one and the next, in the next slide, how this is a very robust ecosystem. And this gives it predictability. The material that passes around, the kind of bullets on this weaponry, as it were, that's fleeting. That can come and go and can change. 1 minute it's the chips, in vaccines. The next minute it's, kind of, if we could just go back to the other one, Matt, just to, a moment. So the material is fleeting and you'll never be able to kind of catch it and map it out because it changes all the time. But the ecosystem, the machinery that produces it is robust. And this gives a kind of predictability for the next crises. So what you're going to see in the next slide is I'm going to zoom in. So the message of the first slide is, if you look at these circles, look at how they're connected to each other. Look how local communities, so communities that identify as local, a parenting community in some small area in Ohio, is one link. They're connected into the content and the comments of a community that's meant to represent the entire Australian, kind of anti-vaccine movement. So this issue, the question of the distrust. So within each of the circles, you have up to 100,000 people who trust each other on some issue, parenting, autism, whatever it is. And they can build distrust of something else. These are the communities that these people turned to when there was a gap in the scientific information in early 2020. And so the takeaway message from this first slide is, look how local and global are connected to each other. In the second slide, which don't go to yet, but in the second slide, I'm going to show you how that glocality is now also across topics. But in this first slide, you can see how if you've got an intervention scheme or you've got a budget or you're dealing with something at the local level, you're fighting against something you're fighting against the whole of Australia. If you've got something in the national level or the state level, you're fighting with some very active town in Saskatoon in Canada. And this is who are supporting the distrust. And it's only by understanding this, by having this map, that we feel that we can then have effective intervention to know then when the pushback, if there's pushback, where it will come from. So you're looking at a subset here of the 5 billion people on Facebook, and there's about 500 million you're looking at in the whole ecosystem that have vaccine distrust prior to COVID. So if we go to the next slide, this is what it looks like now. And what I've done is I've extracted out lots of little dots. Each one of these dots is a community. This is what it looks, this is what distrust on Facebook looks like now. And if you focus in on the upper left, you'll see reds, anti-vaccine communities. Some have gone since COVID, been replaced by others. Blues are in some sense all of us, local, state, national, global health, official health communities, Gates Foundation, Sabine vaccines, anyone who's nurses who vaccinate, any community that exists on Facebook that's promoting public health is blue. And then the other colors are the communities that were concerned early in 2020. They were already worried about vaccines in general, but then when there was the information gap at the beginning of COVID, they began to pull each other together. So proximity of circles means closeness and more likelihood of sharing information. And I'm going to just focus in on one of the little, there's the parenting of the light blue. They moved very close together to the alternative health. and that also moves into things like, yoga, natural products, taking care of yourself. Some of these communities very, probably promoting very good things, but they moved very, very close together in early 2020 and became the source of each other's information. And that continued. This same picture went through monkeypox. We've got it mapped out for monkeypox. We've got it mapped, and it looks exactly the same. So in the panels, so I'm going to have to finish soon, in each of these panels, and I'll just direct you to that panel F, you can see what parenting communities, who may be talking about anything, how many hours of TV a kid or screen time their kids should have, which schools to go to, they can be local, they can be global. They're talking about all sorts of topics now. And in yellow particularly is the abortion topic. You'll see in G, the N, who would have thought this? The N, the kind of GMO communities are really up on abortion misinformation. Promoting ideas that really we would count as misinformation. Also, election policies, looking into they're creating discussions about local, state, national health entities. And so the takeaway from this is that by knowing the map, and I'm sure this is imperfect at the moment, but by knowing the map, whatever mitigation scheme you have, you need to know this map, we feel, in order to know what will be the impact of when you intervene, and also to measure then how an intervention has fared. So with that, I'll leave it. Thank you so much.
Thank you. That was a brilliant starting shot for this panel. And so without further ado, let me turn it over to Alejandro to provide his global perspective. So really pulling back and to give us a bit of context about how does this look like at the community level. Thank you so much, Neil. Alejandro, over to you.
Thank you very much, Elisabeth. Can you hear me?
Loud and clear.
Great, awesome, thank you. And Matt, if you can please help me with the slides. Thanks, everyone. So really excited to be here. As Liz mentioned, I'm Alejandro. I'm the lead social scientist for the Rooted in Trust project. So just to the next slide, to tell you a bit quickly about Rooted in Trust. First of all, what we are. So it has a bit of transitions, Matt. So if you can just go through them, you can open them. Yeah. So what we are, we're basically a global pandemic information response program. We're financed by BHA, and for the past 2 years, we've been addressing the unprecedented spread of health-related rumors and misinformation. Where we work, so just the next one, we work across 13 different locations, mostly on the global south, and especially places that have some sort of humanitarian crisis. And the next one. So how we do our work? Well, we partner with local grassroots organizations in each of these contexts. We've created over 41 partners, and through those partnerships, we basically do community-driven rumor tracking and social listening. We've tracked over 35,000 rumors, and we use the analysis of those rumors to promote two-way dialogue between humanitarian, media, health, and community actors. And we do this mostly through the production content and information that is localized, contextualized, factual, and most importantly, responding to community needs. So we've worked in over 31 different languages. We've produced over 130 rumor bulletins and 500 radio broadcasts. All of this with the objective of using social listening to promote resilient and better prepared information ecosystems for marginalized and at-risk communities. So that's a bit of what we do, but today I want to talk to you about it, and we can go to the next slide. Part of my job within the Rooted in Trust is based on the empirical and practical work that we do in these 13 different locations. We produce global level research on infodemic management and areas that are relevant, that is evidence-based and driven by this practical work. And one of the current pieces that we are developing is on information ecosystem preparedness. Basically, what we've noticed is that the COVID-19 pandemic has shown us that the state of an information ecosystem, particularly for vulnerable communities, greatly influences the effectiveness of an information response. Internews has actually argued this previously. In 2015, we wrote that healthy information ecosystems promote resilience, while weak information ecosystems can seriously hinder preparedness. And to the next slide. So this research that we're currently undertaking is based on a knowledge gap which we identified, and it's basically a need to understand better what information ecosystem preparedness means for different actors and stakeholders, and what are the challenges and strategies for its implementation. So based on that knowledge gap and on where we're positioned at Rooted in Trust, we're delving into this question. And although the final paper is not out yet, I wanted to share with you a bit of our hypotheses and our thinking so far, which we're testing on the field and which are relevant for the conversation today. So with that, to the next slide. Thank you. And this one also has a bit of animation, so we can just go through them. But basically, what our hypothesis is and what we're testing on the ground is that information ecosystem preparedness is really about fomenting real dialogue and exchange of information amongst the information ecosystem stakeholders. So in our case, where we work with vulnerable communities in humanitarian settings, those stakeholders tend to be humanitarian and health actors, health systems, media and journalists, but also very important civil society organizations, community leaders, and local and national authorities. And all of this, the objective of this preparedness approach that we're hypothesizing about is that when the crisis does come, communities, particularly vulnerable communities, need access to science-based information, which tends to come from the academia and health agencies, but this needs to be combined with the latest contextual knowledge, which tends to come from civil society organizations, through community engagement, from community leaders. And this should be discussed via two-way communications through channels and platforms that communities have access to and are likely to use, which brings in local media, civil society organizations, again, community leaders. And so what we are proposing that preparedness is about building and maintaining those networks and relationships across an ecosystem that at the time of an emergency are going to allow those moving pieces to be together. And so social listening really becomes, as Neil was just showing us, a really practical tool to understand which ones are those connections that need to be built and strengthened across actors. And I saw that on the previous talk that we're talking about interdisciplinary approaches. That's also an important area where social listening can give us and has given us a lot of insights into, for a particular community, what are those relationships that need to be built across actors. And why is all of this important? Well, basically what we've learned from our work is that it improves coordination, and it avoids that at a time of an emergency, communities end up there's a lot of actors with very good intentions, but because those builds and those networks have not been built previously, the communities end up receiving ill-timed and ill-informed communication, which actually further alienates them and is a spreading ground for misinformation. So that's, as I said, that's our hypothesis. We're still testing it on the ground. This research will come out and we'll be happy to share it. If you can just switch to the next slide. Just for a bit of context, this is one of the various research that we are producing or have produced. We've also, you might have seen some of our other work on turning social listening data into action, or trust framework. We also looked at how the Russian invasion of Ukraine affected misinformation in the global south. And there's a variety of ongoing research projects like this one, like one on inequality-driven mistrust. We're also looking at the relationship between social listening, information ecosystem approaches, and climate change impact. All of this to say that feel free to follow us, look at our website, and keep an eye out for all of this ongoing research that we're carrying out. Thank you very much.
Thank you, Alejandro. That was beautiful. And I think it also really highlights that the reason why infodemic management is such a fascinating field to be working in is that it's the great leveler. No country has done a super fantastic job at it, so we can all learn from one another's experiences. And I think the approaches that Internews has used very much points to really practical applications of how you might do that in much lower resource settings. And so with that, let's turn it over to one of the most global jurisdictions that we have in the United States. So I'll turn it over to Maddie Perlman-Gabel from the New York City Department of Health and Mental Hygiene.
Hi, everyone. Thank you so much for having me today to speak about our agency's experience setting up a misinformation response unit. I just want to warn you in advance, it's allergy season. We have flowers. I'm going to do my, and please message me if my voice disappears because when my headphones are on, I don't always hear everything. So I'm Maddie Perlman-Gabel and served as misinformation lead and equity specialist during the agency's COVID-19 response. I would like to start with some quick context as to why the agency created a misinformation response unit and why the unit was situated within the agency's vaccine equity branch. With 8.8 million residents, New York City is the largest city in the US. The city is incredibly culturally, ethnically, and racially diverse, with over 40% of residents born outside of the US and over 700 language varieties spoken. New York City is also a city of deep inequities. Structural racism and community divestment has contributed to an unequal burden of diseases throughout the city, especially among Black, Latino, immigrant, and low-income communities. The COVID-19 pandemic further showcased these health inequities. For example, the earliest peak of COVID-19 hospitalizations largely impacted low-income New Yorkers' neighborhoods. When COVID-19 vaccines were made available, we knew we needed to ensure that communities that were hardest hit by COVID-19 earlier in the pandemic needed to be prioritized. The agency saw disparities in vaccine rates by race, ethnicity, and neighborhood, especially in neighborhoods with low trust in the government and health institutions. It became clear that lack of vaccine access was not the only reason for low uptake of COVID-19 vaccines. Next slide, please. Sorry. This was what I was showing before about how disproportionate the vaccine uptake was across the city. Next slide, please. The agency's misinformation unit was developed in March 2021 as part of the agency's vaccine equity plan. The misinformation unit used the framework of infodemic surveillance to identify challenges to vaccine confidence. The unit was initially located within the Vaccine Operations Emergency Response Group, but eventually moved to the Integrated Data Team Emergency Response Group as part of the ICS structure. Though we titled the work as a misinformation unit, we actually looked at the larger spectrum of questions and concerns that could lead to low vaccine confidence. The work of the unit fell into 3 overlapping strategies: surveillance, response, and evaluation. The unit was responsible for monitoring misinformation, leading weekly cross-agency discussions about prevalent vaccine hesitancy trends, assisting with responding to misinformation by disseminating accurate information, and evaluating the need for ongoing responses to misinformation, and supporting equitable misinformation response activities. Next slide, please. The unit analyzed data from both internal and external sources to determine what misinformation was most likely to impact vaccine confidence in the city. For external surveillance sources, we use a combination of industry reports and dashboards that focus on national and international trends, and a cybersecurity contractor who conducted multilingual misinformation surveillance. We were also able to use social media and news scans that were already being conducted within the agency, and these contain everything from like looking specifically at equity issues to local news. With over 1,500 people activated or hired to work on the COVID-19 emergency response, the agency's extensive engagement activities provided invaluable community feedback. Feedback was collected both formally and informally. Some examples of feedback included qualitative analysis from town halls about COVID-19 vaccines, community-based organization report outs, feedback collected during provider detailing, and health opinion polls collected by the agency. Next slide, please. The unit worked with members of both permanent agency structures and structures that were created as part of the emergency response. The unit worked with ICS structures typically associated with emergency response, such as the Public Information Office and provider communications, but also worked with engagement and subject matter experts from across the agency, including the Bureau of Maternal, Infant, and Reproductive Health, School Health, and the agency's Health Action Centers, to name a few. This allowed for the cross-agency response and sorry, it's saying that I'm having computer issues. The expanded engagement allowed for a better understanding of what is going on within our communities and allowed for a rapid community assessments of new misinformation. To be a response-ready, next slide. To be a response-ready organization in the 21st century, we have to consider infodemic management as part of routine public health work. We're going to have to be proactive, imaginative, and collaborative. I know these are terms that everyone has used so far and will continue using today. So we apologize for being redundant, but just, this is what's going on. Our first recommendation is to prioritize equity and accessibility. It is important that government and non-government organizations prioritize communities that can be more harmed by misinformation. It is important to deeply listen to communities' needs and to respond to any issues that come up. Our second recommendation is to think globally and act locally. Yes, we've heard this already today, and I'm sure we'll hear this again. Our digital world is globally connected. When conducting surveillance, it is important to reflect the languages of the communities that we serve. Government agencies should know how their communities get their information and know how to use these communication networks for amplifying correct information. Our third recommendation is to grow external relationships. We found that trust building was the most important aspect of our agency's misinformation response, especially since the mistrust was one of the most common underlying themes in the misinformation we identified and responded to. Our fourth recommendation is to foster internal collaborations. Having a misinformation unit dedicated to coordinating between programs allowed the agency to more fully use its resources and collaborate. Creating and distributing reports is not enough. Meeting regularly is important to identify and respond to misinformation and community concerns. Finally, consistent monitoring and evaluation capacity is essential for infodemic management within a public health agency. This cannot be done without buy-in, continuous funding, and resources. Building infodemic response capacity should not only apply to emergencies, but for all public health work. Final slide. For more information about our work during the COVID-19 pandemic, we recently published a paper in the New England Journal of Medicine. It's Catalyst for Innovations, which will be within this event's materials. And also really want to thank every single person within our agency and outside of our agency, the thousands of public health workers and agents and co-workers who dedicated their time to do everything possible to ensure community wellness. Thank you, everyone, and thank you again to everyone who we worked on this presentation together, and thank everyone again.
Thank you, Maddie. I want to be like you when I grow up. You guys did an amazing amount of work during the pandemic, building entire systems and new ways of collaboration in midst of complete chaos. And you guys all deserve major props for that. And it really took a village to do. So thank you. And now Chris Voegeli has the challenge of somehow topping that and topping all the previous speakers. And talking about the CDC perspective about how Infodemic Insights fits into CDC's work and how Chris really sees supporting states and jurisdictions and the needs that will probably come out of this entire meeting. So over to you, Chris.
Thank you, Liz, and thanks to the Academies for having me. Let me share my screen. Share from the beginning, just for fun, presenter view. All right, so yes, my name is Chris Voegeli. I'm the Acting Vaccine Confidence Demand Lead, but I also serve another role, there we go, which is the Insights Unit Lead. And the Insights Unit creates the State of Vaccine Confidence reports with a great methodology, but just a great team set up by Jess Collis, Kate Brockmeyer, and many others that contributed to creating it. So I'm just carrying their work forward. And first, I'll just reiterate a theme we've talked about a number of times this morning, that understanding really underlying themes and developing ways to address them seems to be a critical part of the infodemic, that there are many reasons why people either have access to inaccurate information, they can't access accurate information, or experiencing information voids. And getting a whole picture of that issue, I still see just as a big priority here. And that is one of the things the State of Vaccine Confidence Report does. Initially, it was the COVID-19 State of Vaccine Confidence Report. Now it's just the State of Vaccine Confidence Report as we've moved to peacetime and have now expanded it to really all vaccines and other topics in general, which I'll get into. But one thing I love to harp on here is that this is a table from our reports that tries to identify all of the different data sources. And depending on the report and what topics are being covered, it can run about 24 different sources that our team of 7 to 8 analysts review, analyze. And through this process of integrated analysis and really application of the scientific methodology, inference to the best explanation, we try to come up with the story of whatever that theme is, and then provide recommendations for how to address it. But you can see that the data sources are quite varied, right? From Google Trends and Meltwater to our own CDC data sources like CDC Info and the National Immunization Survey, but third-party reports, and trying to marry all those, once again, to tell a story. Now, this is I won't dive into this deeply, but just to say that we have this process and this methodology, a true iterative and deductive, inductive both approach, where the analysts are really isolated to like data sources, what we call streams, and then they're pulling that data, looking for those themes that I always say rise to the top, but those that should be of most concern, of most risk for us. And then we compare those between the streams, looking for similarities and differences, and then just repeat the process until we believe we have a good, solid understanding of it. I'll get into the major emerging continuing in a second. I think there's one other point I wanted to make here, but I forget it, so we'll go on. Yeah, and that synthesizing multiple inputs and identifying themes through this consensus building approach, we adapted and created a threat classification matrix where, yeah, depending on the spread, who it's impacting or who the theme narrative is likely to impact or where it's spreading from, plays into it. We added a positive sentiment. Gosh, I don't even know when, but I think we've only used it 4 times through the pandemic and since, which goes to say how the pandemic went, I feel like. But it's probably worthwhile to point out that during the pandemic, these reports were published bi-weekly. Then for about 6 months, they were monthly. Now we're doing quarterly reports. And instead, every month, we're doing 2 or 3 special reports where we dive in on either a specific topic, a population, demographic, or a geography was actually what I meant to say. But either way, and trying to better tailor our listening and our interventions and approaches to really get down as far as we can to the community level. And then since the analysts are tracking these streams through the weeks, we then give an indication of whether or not it's increasing, stable, or even decreasing. And one thing we always found to be really important in these reports is that, we can't just give people a lay of the land in terms of the theme. We also need to provide some hope or something they can do to hopefully address it. And that's our ways to act section. The report goes out to a little over 1,000 different people, organizations that run the gamut, from grassroots organizations and CBOs to other governments and even WHO. So it's a struggle to make the recommendations too specific or specific enough, but either way, we think that they provide some guidance on a path moving forward. And the recommendations usually fall into 3 batches here of communication, programmatic approaches, and then additional research. One thing I love most about this report is that since it started, we have been able to see not only that the conversation has shifted and changed, but also the themes themselves. One of my favorite examples is the theme of immune erosion. That was extremely popular. And then probably by some great branding technique, they decided to start giving it an acronym, VAIDS, Vaccine-Acquired Immune Deficiency Syndrome, which then in a month or two, it became that the vaccines would give you AIDS. And then it was the vaccines would give you HIV. And nowadays we said that the vaccines will make you more susceptible to STDs. But it's fascinating to see that change over time and to see where that comes from. We did an evaluation of the report back in 21, and these are the most common ways that our readers said they were using the report. I think the top ones, it's about 70%, where it does help them inform communication strategies, but also personal understanding of vaccine confidence issues, partnerships, understanding vaccine hesitancy across special populations, and then prioritization. And I will say one additional piece we have added to the report is a link to a share file folder that actually provides assets, talking points, social media calendars for our state and local jurisdiction partners, and really anybody and everybody to use as they see fit to hopefully address these themes. And the big takeaways is always just that there's no silver bullet. Limited tools exist to address disinformation. It's just the infodemic issues in general. But debunking misinformation alone ignores these real larger social and cultural forces that caused the misinformation or whatever it is, the lack of access to information to emerge. And we really need to start addressing those, especially trust in institutions. Traditional risk communication and social media outreach approaches are probably not sufficient. There's just so much information out there that it's hard for people to take it all in. And to address the current infodemic, yeah, definitely evidence-based approaches, leverage socio-behavioral and epidemiological insights, and then actually do something about it. Okay, well, that's me. Thank you.
Thanks, Chris. That was an admirable attempt to top the other 3 speakers. It was great. And so I know we only have roughly 6 minutes. So let's see how much Q&A we can cram into 6 minutes. And we already have a few questions. If you don't have a question yet, feel free to share it, and then maybe it will be put into the hopper. So for the first question, we have one for Neil. In your systems analysis, what groups drove vaccine distrust in response to the Mpox epidemic? Were there any groups that were carryovers from the COVID-19 response, and any groups that were distinct?
Yes, and yes. So the parenting communities early in COVID moved very closely. They formed a lot of links with alternative health. They were looking for answers for the kids. This was in January, before it was even a proper pandemic. We get to monkeypox. Those bonds are already there. Those bonds have not gone away. So during monkeypox, those discussions were the roadways were there. So the cars just went along it. And so, yes, alternative health, a key thing, organic foods, alternative health, those were very key communities for the parenting communities. And now they've got more into the topics of like abortion, so yes, there are, and it's by mapping it out you can see those key things. And I should say that we are only talking about Facebook there because that was the majority of the conversation, but in the background I happen to have that the entire universe, as it were, with things from Discord channels on gaming sites through to more fringe, what are not really fringe, but they're just less well known. Thank you.
Thanks for that, Neil. All right, I think I have a question for Alejandro, and this one is misinformation entirely out there? What else might be causing public mistrust in health messages? Are journalists misunderstanding confusing or incompatible messages coming from us as well? So what role do journalists play in interpreting health guidance? And are there other reasons that people might not trust based on not just health information, but other issues that you've seen in your community social listening?
Yeah, thank you, Liz. So yes, I think we've seen that there's many different issues that are not just related to access to information or that affect trust. One of the key lessons that we've had from our project is that although vulnerable communities in this context that we work with, they do need access to information. One of the main things that we've seen through our information ecosystem assessments is that they want access to information that speaks to their realities and their context, which I think goes in line a bit with what Maddie was saying, that it's not just about access, but also the equity and what people want. And that's where social listening comes into play a lot. Another important issue that we saw that affects trust in the way that information is passed on is the timeliness on when it's done. So, for example, with all of the sudden shift to the coverage on the invasion of Ukraine, even though it had nothing to do with health, we saw that in the refugee camps in Iraq, for example, it created a lot of mistrust of why are you all of a sudden focusing on this? Does this mean that COVID was a lie all of a sudden because now there's no need to focus on this? So the timeliness of when information is passed along, even if it seems far away, we saw that ended up having that influence. But yeah, I think overall it has to do with how information is rooted on the needs of communities and their lived realities.
I think that's perfectly put. And maybe to link to the next question, I'd love to get Maddie's and Chris's take on this as it relates to identifying when do you actually need to take action versus just narratives or misinformation that are concerning but might not require action. So the question is, how can one effectively monitor the information environment to identify, characterize, and detect an epidemic or an event? So basically, what do you do when it's a really high threat issue? When do you know that you need to take action? And I don't know if Maddie, if you wanted to speak to any particular experience of a narrative that maybe your office took a specific action to address.
When I said resources, apparently resources is a bigger issue than I thought it was because I had time out, all that. Anyway, I think what I think is important is the more viewpoints you have in your direct unit to bounce things back and forth. That's sort of how we made our decisions, and what is probably will be a priority and will less be a priority. We also, first things that we had to do SNAP, we had a lot fast. We had a lot of papers going up throughout the city. There was in one neighborhood where there was especially low vaccine uptake, just starting from the beginning, and there were posters throughout the city, throughout this neighborhood, and we had to work with other agencies to take it down. So sometimes there's we've literally direct action stuff, and that's usually something that doesn't really need as much discussion about, but having a larger having people from different backgrounds is really helpful. Our direct unit, we had someone who was medical, she was a doctor, we had a policy analyst with law background, and then we had 2 program specialists. One could speak Spanish as well. So just having a core team to bounce things back and forth, that sort of is a good start in what's priority to respond to and what's not.
That's really helpful. And maybe to pitch it over to Chris for a kind of a final word. I think all of us who've worked in this space have had the issue of our boss emailing us some piece of misinformation that crossed their desk and saying, is this a concern? Is this something we need to address? Is this high priority? So again, how do you gauge what is actually something that requires action versus something that's nice to know, but maybe doesn't need any direct action? So Chris, any reflections on that?
Yeah, well, and I feel like that's why the threat classification matrix is really helpful, and then ensuring we're incorporating this equity lens to it as well. But I'll throw out that from a practical standpoint, yes, some of the misinformation we probably couldn't do anything about anyway, even if we had time, resources. So I think of the I don't remember when this was, 6 months ago, a year, time's relative these days, but the belief that the US government made a pact with the devil to get some poison from him, and that's put in the water supplies. That's we can't really do, like, that's outside of our scope enough. But then, in those instances where we think it's going to have a big potential for impact, is a phrase I stole from our national security counterparts, figuring out, where our efforts can best have some sort of impact, that continues to be a struggle, because too often the answer is just putting out more messaging. And I'm always concerned about that, given this infodemic frame, that it's likely to be ignored. Message fatigue, pandemic fatigue, still alive and still going strong. So yeah, it's a need to not only prioritize those with the best or the highest potential for impact, but then actually dedicating your time and resources to where you can make an impact, because we're all overworked and there's not enough of us and not enough money. So yeah, that's what I would say.
Well, I think that's a perfect way to end this this panel discussion. It's not just deciding which ones are the most risky narratives and taking specific actions, but sometimes recognizing the health authority might not be best placed to address it directly, but working through partners, working through networks, and recognizing that trust is really inherent to this entire conversation about how infodemics affect communities and how they're willing to take on any interventions you might try or strategies that you might try to implement from a health authority perspective. So I want to give a massive thank you to Neil, Maddie, Alejandro, and Chris for their talks today. And please, folks, reach out to them if you can, if you find anything that they've said massively interesting. I dropped a link to the NEJM article that Maddie talked about into the chat. But we hope that you enjoyed this particular panel, and hopefully that sets you up really well for the next panel. And with that, I'd like to hand it over, I believe it's to Hillary.